Michelle Cordero here, Director of Education at ASIS Massage Education, and coming to you here about with another great guest, another great topic that we're going to explore. We're going to be talking about doing our work in the field of oncology, and particularly with MLD or manual lymph drainage. So my guest today is an instructor with our sister school, the Academy of Lymphatic Studies. So we're going to bring her on and say hello. Let's say hi to Rachel Alonzo. Hi, Rachel. How are you?
Hi, Michelle. Good morning. Thank
Good
you for having
morning.
me.
Of course. Thank you for agreeing to do this. And
Mhm.
I was really excited when you said yes, because I enjoyed our small chats that we had. And I really thought you'd be a great person to reach out to for this conversation. To start, can you tell me a little bit about yourself and how you got into your field and what it is you actually do? What's your day job, I guess, and
Okay.
how you got to start that part of your career.
Yes, ma'am. So, my name is Rachel Alonzo, and I am by trade an occupational therapist. I've been a practicing OT for about 22 years, and I have been specializing in lymphedema and manual lymph drainage for about 9 years now. And currently, my day job is I work for Mayo Clinic, where I specialize in oncology and lymphedema, and also participate on the research side of things as well.
Oh, very
Hmm.
cool. Ooh, I'll have
Yeah,
to chat more about that.
yeah, that's
Awesome.
exciting.
So, how did you get involved with ACOLS, our Academy of Lymphatic Studies, our sister school?
Yeah, so about 9 years ago, when I decided to learn more about the whole complete decongestive process of treating lymphedema, I got the opportunity with ACOLS to take their courses, and just I've always had a soft spot for ACOLS in my heart, and have taken courses with them for several years now. And what I wanted to do is kind of shift over to the teaching side, just to kind of give back to what they've always provided for me. And I just noticed over the past 9 years that there is a large population of patients to work with. There are so many people that are in need of our services, and there's just not enough providers or clinicians to be able to do that for them. And so I felt that being part of the movement and helping get clinicians trained out there would kind of help, in the long run, as far as getting the word out there that yes, these conditions are very much treatable. They can all be treated through conservative measures of therapy and doesn't necessarily need medications or surgery. And
Mhm.
so that part just really spoke to me, and that really inspired me to want to be on the teaching aspect of manual lymph drainage.
Oh, I love that. That's
Hmm.
awesome. So, a couple of things about your background that makes me have some questions about. So, I don't know if everyone that watches, particularly our students here at ASIS, knows about the scope of practice of an occupational therapist. It sounds like it's pretty vast, because when I first think of occupational therapy, I'm thinking more of like more ADLs, the activities daily living kind of things. And so I'm wondering already myself how we get from that to lymphedema, and is that connected? And could you explain a little bit about that scope? And
Right.
maybe that's a whole other 5 hour conversation, but
Um,
in a little nutshell, how like what people who are an OT can do.
Absolutely. And Michelle, I feel like I must have answered this question so much during the course of my career that I probably could answer it in my sleep. But yes, you're completely right. The general idea of what an occupational therapist does is getting a patient back to their activities of daily living skills. So whatever impairment that they have that keeps them from being independent and safe on what they need to do on a day-to-day basis, I address those impairments.
Mhm.
And so I've worked in various settings where I've been able to, practice getting those patients back to what their goals are. And when it came to my specialty of lymphedema, it's a very debilitating condition that really keeps people from, a lot of times, if it's in the worst stages, getting out of bed, getting out of their chair. And so I'm still able to practice what I do as an occupational therapist, but also, having the background of lymphedema, be able to treat what their impairments are in regard to that. So it is, people always ask me all the time, like, how did you get into especially lymphedema, or how did you decide to get certified with manual lymph drainage? Oh, well, it's basically to get, using these interventions can get people back to doing what they need to do most in their daily lives.
Okay, very cool. And so as an OT, you have the scope to be able to not only I'm I guess assuming here, and you can correct me, to not only apply some treatments to the person, do some MLD on them and perhaps bandaging and things like that. But you can also prescribe exercises that you do with them and they do at home, or is that
Correct.
part of the whole treatment plan that you do?
Absolutely. So, the beauty of being an occupational therapist is you kind of have a holistic approach to the patient's well being. So, yes, I do a lot of manual therapy type of techniques, but I always think about, what does this person need for the long run? So, yes, developing a home exercise program
Mhm.
that's going to get them on a better, healthier track in life, and just also working with them as far as what a good diet might be, what that might look like. But it's a very much a holistic approach as far as regaining independence, but also keeping it in the years to come.
Okay. All right. Very cool. So I assume then as well that most of your patients, you don't see just one time. You're going to see them over a course of a period of time because you need to see how they're doing better and adjust the
Absolutely.
protocol and that kind of thing. So,
Yes, ma'am.
um,
Yes. So I do meet patients initially, but over the course of 22 years, I have a lot of patients that continue to reach back out to me just for consultation purposes, if they have questions, or if they just want to, pick each other's brains at,
mhm.
whatever recent research is coming out, then I love doing that. And so even though I only work for a patient maybe for a short period of time during the rehabilitative process, I feel like being an OT, you get to play like a role in their lives where you continue to encourage them and help them through whatever process that they're going through next.
Awesome. And you use
Mhm.
the word role, and I want to jump on that too, because I heard you also say you work for Mayo Clinic. And when I
Mhm.
hear Mayo Clinic, I think of a collaborative approach. I feel like there's a whole team of people that are working and helping the patients. Is that the case with your approach to your patients or who you work with, that they're seeing multi-disciplines to help them in there, or not so much, or it depends?
No, absolutely. It is very much a team collaborative effort. I have never worked in a setting where I've seen this at its finest.
Mhm.
And for example, I specialize with a lot of oncology patients. So the minute that the patient is diagnosed with cancer and a treatment plan is developed, I'm getting referrals from oncologists and surgeons to see the patients even before they go into surgery, because they know that it's going to be a long process ahead of them. And they even take into consideration what this patient is going to need before, during, and after their cancer treatment. And that is very much a collaborative effort. And I just love working with doctors that really look at medical care from that type of perspective.
Yeah. Oh, I love that. I love
Mhm.
that they're looking at the before part. I know that's something with MLD. I just involved in the MLD certification
Mhm.
part, but that is something that we talk about in the classes when people say, "Well, when can I use this?" Because
Mhm.
they need more education in certain things, work in oncology or post-operative and that kind of thing. And we're saying I know I've always had that conversation with students that this is great for when you know someone's about to go in and get an operation and they need kind of a priming of their system and doing this work. So that's really that makes me feel very hopeful to hear that doctors should look at. You hear a lot about people just want to go under the knife and suggest this and do this, and it's nice to know to hear in real life that there's a multidisciplinary, multifaceted approach to for the overall health and well-being, wealth,
Absolutely.
that's wealth
Yeah.
together for the
Yes.
patient.
Yes.
Um, so that's amazing. So let's chat about that a little bit because we're talking about oncology in particular. So, what did you work with patients in the oncology world before you started working with MLD in other ways, and you saw that MLD would be helpful, or did you start with MLD and then start working with oncology patients?
Um, well, to be honest, I started working with just lymphedema patients.
Okay.
And so that could be, there could be various reasons as to why they had lymphedema. And so it could be anything from venous issues to actually oncology issues.
Hmm.
And so I started off with just treating the condition of lymphedema. But as I started to get more exposed to the oncology side of why they had lymphedema, as far as, mostly through surgery, removing of lymph nodes, then I got to know the oncology side of that a little bit more, as far as what is the process of that? What are these people having to go through? And then, this was before coming to Mayo Clinic, where I had the ability to see patients in their homes. I was working for a home care setting. I was also working in a hospital in an inpatient setting. So just being able to see where patients were with the different stages of the cancer treatment route was
Hmm.
very eye opening.
Okay. Wow. Very cool. So, what did you see then with using well, you were doing complete decongestive therapy, but and so I kind of want to go into more of specifically the manual lymph drainage
Sure,
part of
sure.
it.
Mhm.
So what were some of the results that you were seeing or hearing about, or just kind of witnessing some of the changes, or maybe even just the keeping things even? Like what were some of your moments?
Yes. So, as I mentioned, I was working in various settings with these oncology patients. So,
Mhm,
starting in the hospital when they were just freshly out of surgery, fresh incision sites, and really just trying to learn the basics of being able to move around in bed, get out of bed, and,
mhm,
get from sitting to standing, very basic tasks that they had to relearn after such an intrusive surgery.
mhm,
I was able to use manual lymph drainage to be able to help control the swelling a little bit more than it would have done, like just through your traditional approaches.
mhm,
And it has a calming and analgesic effect. So, a lot of times, oncology patients um, after surgery are feeling pretty high with anxiety, and
mhm,
um, their pain level is very high. And there's a lot of times during this part of their treatment is when they have to rely pretty heavily on pain medications. So,
mhm.
being able to get into a person's hospital room and be able to provide manual lymph drainage to help in all of those areas, I thought was very beneficial to them. And that's the feedback that I was getting from them. And so that
Oh,
helped kind of kick start their whole rehabilitative process to make them kind of feel like, okay, I can do this. This is very much possible. And
mhm,
then moving on to like when they would go into, the home health care setting where they're situated in their home, trying to get adjusted to their daily lives again, but still having the symptoms of pain and swelling. Because at this point in time, okay, surgery's done. For the most part, the cancer is out, but now I
mhm,
have to go through radiation therapy or I have to
mhm,
undergo chemotherapy. And that in itself, will cause even more of a stress to the lymphatic system. And so people continue to have the symptoms that they're having, even that kind of further out away from their surgery. So being able to shift gears and perform manual lymph drainage in the home health setting um, help them to get through radiation therapy a little bit more smoothly. It was kind of keeping the damage that radiation therapy does, all the side effects of it, as far as damage to the skin, damage to the lymphatic vessels. It was kind of able to keep most of those things at bay, I
mhm,
saw,
mhm.
when patients were able to get therapy in conjunction while going through their radiation therapy.
Wow, that's
Yeah. And then in
amazing.
the long term effects, once cancer is out, they are cancer free. Every that's there's so much to celebrate there. And everybody for the most part thinks, oh, great, you're cancer free. That's awesome. Life goes on now. But that is sometimes, well, mostly all the time, that's not the case. Like they
Right.
continue to have um, the struggles that they have with residual pain, and that is a lot of trauma that their body went through. So trying to fight through that with regaining range of motion and strength, I
Mhm.
felt that all of the manual therapy techniques all came into play
Yeah.
to be able to help them to be able to achieve that and ultimately get back to their life as much as possible as the lives that they had before they were diagnosed with cancer.
Yeah.
Mhm.
I like that you bring that up because I think a lot of times, so I relate it to, I work with as a massage therapist, a lot of pre and perinatal people.
Yes.
And I feel that once the
Mhm.
baby's here, it's like, okay, everything's about the baby. And we forget about that person who just birthed this other person and created life and everything.
Exactly.
And their
Yeah.
body is in much need of some help to kind of, I hate that bounce back, but in a sense, bounce back, you
Mhm.
need just to
Mhm.
resume regular daily life. And I think that is, I feel like that happens also in the oncology world. Like you said, everyone's, yeah, cancer free sounds great, but we forget all those things. Like they were just focusing on getting cancer free and getting
Exactly.
better. And so
Exactly.
other things went down to the side and wasn't as high priority. And now that we can take a little breather about the cancer, now
Mhm.
here's the time that we can work on the body. And so I think from my, but when I hear people talk about, oh, I don't know if I want to work with oncology patients, it sounds
Mhm.
scary, I don't want to hurt them. And this is a great way into that world of helping them, is that post recovery
Yes.
time, that if you're feeling like,
Totally.
oh, I don't know enough about cancer to be there during treatments, that might not be as much needed as the afterward.
Yeah. Yeah. And that's understandable. And I do get that feedback from other clinicians too
Hmm.
and previous students that I've worked with that oncology can be a tricky area. Absolutely. There's a time and a place to do what we do.
Hmm.
But I tell you what, you are going to be the only one of the only person on the medical team that they are actually glad to see
Yeah,
because you just
it's a
give them
nice
so
feeling.
much comfort and relief, and
Hmm.
that can be anywhere in the stage of their cancer treatment process. So I get a lot of joy in doing what I do with the
Yeah,
oncology patient
yeah.
population.
Yeah,
Mhm.
that's it's so rewarding. I can only
Yes.
imagine. I have not worked as closely as you have in many years of experience, so I'm glad we can share that with everybody.
Mhm.
So for people who may be wanting to work in this field, and I hear people saying, "Oh, I want to learn MLD because I want to help cancer patients." But I also know we can do massage and other things, with proper
Mhm.
training.
Mhm.
But why do you think so much that MLD is very much talked about when we're talking about helping oncology patients? Because I feel like I hear it a lot. Maybe it's one of those things where that I'm just thinking I hear it a lot, but I feel like a lot of people think that it can help them. So why particularly do you suppose?
Um, well, with the three main treatment interventions that are used to eradicate cancer, you have surgery, you have radiation, you have chemotherapy. All three of those things damage our lymphatic systems pretty severely.
Hmm.
And the lymphatic system just is very much an underrated system in our body that doesn't get enough attention, doesn't get enough education out there for our clinicians. And so when you have trauma happen to the lymphatic system and all of a sudden you're in a lot of pain, you have swelling, excessive swelling that's there where it's not supposed to be, to the point where it's impairing function for a
Hmm.
patient, then I think yes, I think there should be a strong emphasis on manual lymph drainage techniques and other manual therapy techniques
Hmm.
because the lymphatic system is underrated, but it's also a resilient system. And so when we use these manual techniques, we can really get the lymphatic system working in modified types of ways, so that the patient can be able to function again. It's not that, okay, your lymphatic system was damaged and that's the end all be all. There is a way to be able to get our lymphatic system to compensate for all of the trauma that was done to it.
Right. Yeah,
Mhm.
and so that's where we come in with our magic hands to be able to help it compensate, right? So without us intervening, the lymphatic system is going to usually, maybe slowly, will try to figure it out, and pathways kind of make its way because of the fluid in the interstitial space. The next collectors are going to try to pick it up, but when
Mhm.
there's so much damage, that's, I can imagine, pretty hard for the system to do. So is that
Right.
essentially what we're doing then, is to help that along?
Exactly. I mean, I always try to compare it to like the traffic system during rush
Mhm,
hour. You know,
mhm,
if you have a clog or a jam at an intersection, then it is so helpful when you can be rerouted by your GPS. Like, oh, instead, take this route. This is a much better
mhm,
route, and you'll actually save more time this way and be
mhm,
more efficient. And I feel like
mhm.
that's kind of what we do as therapists when we do our manual lymph drainage, is that we're telling that fluid, you don't have to just sit there and be stagnant. There are other
Yeah.
ways around in your body where you can get
Mhm.
adequate circulation, lymph circulation, and just general blood circulation.
Yeah. And
Mhm.
so knowing the anatomy of the lymphatic system is very important to, right?
Absolutely.
Yeah.
Big time.
I'm always bringing that up. I like that when we're one of my coworkers and I, who also teaches for the academy as well, we're always talking about how we can't learn protocols. Like, yes, it's a good idea to learn like what goes here then there, but what happens when there's a blockage, or like you say, a jam happening right there? What do you do?
Yes.
And you need to know how the system works and how it can get redirected in
Hmm.
order to do that work. So um,
Absolutely.
yeah, especially then that's what we're teaching in our classes. So,
Hmm. That's
um,
awesome.
yeah, so segue to that. So I know with ACOLS we have the MLD certification. That's the 40-hour course that you learn the basic four water strokes and general working with a healthy lymphatic system for the most part.
Hmm.
Then the other mainstay class that we have is the one you mentioned in the beginning, the CDT, or the complete decongestive therapy class. That's the 135-hour one.
Yes.
That is more geared towards people working with people with lymphedema. It's very specific to
Sure.
that work. And that so when ACOLS was teaching those two, we're hearing a lot of things about, I want to learn more about this. I want to focus on this or that. And that's where we came up with the post-plastic surgery courses that we have.
Hmm.
And then one of
Yeah.
our newest classes, the oncology course that you so wonderfully taught recently, the in-person class. In these classes, we are learning more specifics, right? So what are some of those things in the hands-on that we're helping students learn about, that's going to be something that comes up in some of the work with oncology patients?
Yeah. So, a lot of how to handle when you're in certain scenario based situations.
Mhm,
So, for instance, when you have, for instance, a mastectomy, you have a long surgical incision that goes all along the chest wall. So,
mhm,
obviously, that already you have to shift gears and not perform manual lymph drainage like you would traditionally perform in somebody that had a healthy lymphatic system. So
mhm,
knowing how to handle, first off, how do I handle that scar? And
mhm.
then what, let me refer back to the anatomy that I learned so well
Yeah.
and figure out how can I reroute these fluid pockets that are building up along the
Mhm,
chest wall. Um, so, you know, when you're doing hands-on during the course, there's a lot of that going on. There are
mhm,
different other conditions that need very much hands-on experience in a course, so that when you're in the real life situation at the clinic, or in your practice, wherever you might be, you can identify, oh, this is what this is, and this is how I'm going to treat
mhm.
it. Cording's a big one. Cording is
Mm-hmm.
very common with post-surgical patients, and knowing how to identify what a cord looks like and how to treat it depending on where they are with their recovery process, like those are all pertinent information to know. And a lot of times you might be the only person around that individual that knows how to treat that,
Yeah.
so they're
Yeah.
going to be looking to you for this type of expertise.
Right. Yeah. I know I never heard of the first time I heard about cording, somebody called here actually at a massage school and said if we
Yes.
had any students who knew how to deal with that. And I once I found out what it was, I was like, why did you call a massage school? It's like this is kind of like very specialized
Well,
information. So
yeah,
yeah.
but you know what? I have a handful of wonderful massage therapists locally
Hmm.
that they can tackle cording like no other.
Yes.
So
Uh,
I make some great referrals over to them,
yeah.
and I really feel like massage therapists have a great advantage when it comes to
Yeah.
very technical work like that.
Yeah,
Yeah.
yeah. And so, do you hear people use cording and axillary web syndrome interchangeably, or is it more common to call it cording?
I hear it interchangeably.
Okay, yeah.
Yes.
So, and I admit my own ignorance on it wasn't that many years ago. I've been in the field 20 plus years, and I hadn't heard of it before. So, it's something I'm sure people who are listening, our students that are listening, is something that yes, these are the kinds of things you learn about in the oncology
Mhm.
course if you had not heard about it before and understand how it occurs and how you can help people with it because it essentially limits their range of motion right when that
Mhm.
happens and can be painful as well. And so that breaking up that hard band is really important for people, and
Right.
not just like
Right.
digging their elbow in it. That's the other part of it. It's like there's a way we have to do it.
Right.
And
Definitely have
not
to shift gears.
yes,
Absolutely.
yes,
Mhm.
exactly.
Mhm.
So and I know this with the oncology course. I'm trying to think how to formulate this sentence because it's when we were creating it, we were trying to figure out how to address like, I mean, everything in this umbrella. I mean, how can we create
Yeah.
even a 20, 30, 40 hour course to get everything in the umbrella and still feel like students are out there going to be able to handle every single thing that comes their way. And it's really kind of an impossible task like because you don't know can't there's so many types of cancers combinations cancer
Yes.
treatments
Mhm.
individual people who are experience one person and the next person experiencing the same types of treatments are going to react differently. I mean there's so many variables in cancer care that I feel like there's really no one size fits all for anything.
Mhm. Mhm.
And so with our course we had to kind of like balance that a little bit to give people tools that they could be able to use and more information for people to create more of like a therapeutic approach to whatever kind of comes their way.
Yeah.
So what has been your experience? I know you haven't taught it many times, but what's been your experience with people coming in? Is that are they looking for like just tell me what I need to do, give me a protocol, and do they come out saying, okay, now I feel more confident in knowing like whatever comes my way, I know the anatomy, I know the possibilities, and I can kind of make this assessment and treatment plan based on the person in front of me.
Yeah.
They feel
Yeah.
like that.
I agree with you. I think that the oncology world is very extensive and can be a bit overwhelming.
Mhm.
But what I liked very much about teaching this particular course is that it's a 2 day course, and it does a great job at consolidating the most important things, because yes, you're always going to be learning. I think as clinicians
Mhm.
we always need to be learning.
Yeah.
I learn something new every day that I'm at the office, and so I'm
Mhm.
very grateful for that.
Mhm.
um, but the 2 day course is almost like a great recipe.
Uh-huh.
So if you want to bake a cake, you have a cake recipe with just, okay, this is what you need. This is the step by step process on how
Mhm.
you're going to do this. And yes, you can
Mhm.
do this. And now that you know how to do this, let's send you out into the world and you can
Yeah.
make adaptations to that,
Mhm.
modifications to that based on that particular scenario with that patient.
Right.
So it prepares you as best as possible in a 2 day period.
Mhm.
for like the general situations that you're going to come across.
Yeah.
And the way that I like to structure it is that I'm very much I love open discussion,
Mhm.
and I really believe that we always have the ability to learn from others. It doesn't matter who you are; you always can learn from somebody else.
Mhm.
And so, yes, we have this nice recipe that we put together as far as how to do an effective MLD treatment with an oncology patient. But yet, everybody's bringing something to the table as far as this is what I've tried, this is what I found has worked. And then at the
Mhm.
end of the weekend, you're just like, wow, I learned so much today. And I can even say that very much so as an instructor, is I'll
Mhm.
use a lot of things that I learned over the weekend and I'll bring it to my own practice, just because it's impossible to know everything.
Right.
Yes.
Yeah. And I love that you say that because I think that some of the hesitation that I hear from people are like, I would love to work in that, but there's no way I'm going to know everything. And
Hmm.
it's like we're not supposed to. But we're trying to make educated choices, safe choices, working with our patients and clients, and ultimately trying to help them for the greater good of their well-being. And
Right.
that's really all we can really do. I guess
Hmm.
we have to be
Hmm.
educated and know what we're doing. But I think it takes a certain type of personality to be in this field and
Yeah.
to do this, because you kind of have to have, I don't want to say no fear. I don't like, you don't want to be like an adrenaline junkie and like, yeah, I'm going to get in there. But at the same time, you kind of have to be okay with not knowing everything and kind of like going with the flow a little bit.
Right. And I think the course does that. The course is able to take what therapists' worst fears are and
Hmm.
kind of address that immediately as far as like precautions, contraindications.
Yeah.
Don't do this if the patient is experiencing this or presenting in
Mhm.
this way in your practice.
Yeah.
So really does a great job as far as preparing you of what not to do.
Yeah.
But
Yeah.
in the end, there's so much more you can do for the patients versus what
Mhm.
you can't do.
Yes.
So
Yeah.
all of those areas are they're really addressed finally in just a 2 day period.
Yeah, that's really great. And I should mention too, so the whole course is there's three components. So the last part is that 2 day in person, but they do
Hmm.
have a home study,
Yes, that's
which
true.
reviews over a lot of, because you need to be either an MLD certified or a CDT certified therapist to even get into this class. So it's a lot of review of that stuff from before, and then going over general things about cancer and cancer treatments, so that we do that's a home study. And then the in-person, I'm sorry, there's a webinar portion that's live, and that's over 2 mornings that they do that as well. So it's a little more of the meat of the information, so that
Sure.
we save up all the fun stuff, all the hands-on stuff, all the treatment stuff for the 2 day live part of the
Hmm.
course. So
Hmm.
we kind of set that up so that students wouldn't have to take 4 days off of their practice, and be able to make it in a weekend and still get all the materials and the information they needed ahead of time
Right.
in there.
Right.
Um, so knowing that, and I think, what did we say, 26, 28 hours? I often think of courses that are out there that are like an 8 hour course, or, and learn MLD and treat cancer patients in a weekend kind of thing. And I, I wonder what's happening. Some of these days I'm like, oh, maybe I should take one of those to see what's being offered. But
Hmm.
have run into, maybe you haven't, but have you run into anyone in the field at all that have maybe taken one of these shorter classes and maybe aren't as well versed in what they're doing, and how has that worked out for that person's care?
I have
Hmm.
come across different therapists that have done a 1 day course of MLD, and it is mostly geared towards being able to perform MLD for a person who is completely healthy,
Hmm.
that has a healthy working lymphatic system, and does not prepare for somebody who will desperately be dependent on MLD because of a debilitating disease or condition.
Hmm.
And so I think that's where, more intensive type of courses come into play. And so extending it to another day, so like the 2 day on hands course, can really get down into like more scenario based type of situations. And, just like you said, oncology world is so extensive that there's various forms of cancer that you should be addressing that you're
Mhm.
going to be tackling differently in the clinical setting. And then, before the on hands treatment course, the 2-day course, going through the webinar and everything that you have to do through the home study, I mean, that really does a nice job at comprehensively putting things together because the lymphatic system is a very intricate system. And I know that when I'm performing my on hands treatment, I'm reflecting back at a diagram or something that I learned or a
Mhm.
lecture that I listened to. I mean, that always comes into play. Even now, after 9 years of being a practicing clinician, I still rely on my anatomy and physiology to be able to tackle the most complicated, challenging patients.
Yeah.
Hmm.
Yeah, that makes sense. Always learning, right? I
Yeah.
always tell my students that.
Yes.
I joke and I mentioned this a couple of times on different live streams that students will say, "Don't make me leave. I didn't learn everything yet." And
Right.
it's like, well, we're just giving you this little bit so that you can go learn everything.
Yeah. And
You
it's
keep
hard to
learning.
learn all of that
Yeah.
in just one day, your typical MLD course.
Yeah. Yeah,
Mhm.
exactly. Like I'm actually this weekend I'm going to take a pediatric oncology course
Oh, neat.
for massage with children. So
Yeah.
I'm really excited to learn a little bit more about how it's different in a small human and to understand how I can help that population as well. So I'm really excited about it, being
Oh,
able to
that's
do
awesome,
that.
Michelle.
So yeah, so
Good.
be able to incorporate more of that. And just for my own learning, I can't stop. Like, what else can I take? Ooh,
It's a great
so
attitude.
exciting. Yeah.
Absolutely.
There's not enough time in the day to learn all the things I want to learn,
Mm-hmm.
for
Hmm.
sure. So you did mention you do research as well. Is that in the oncology realm too?
It is a little bit, and mostly it's in the lymphedema realm, but I
Okay.
do have oncology patients that are involved in that research study.
Okay.
But mostly it has to deal with modifying your traditional approaches to CDT to make it
Okay.
more effective here in America. That's going
Oh,
to be
nice.
more cost effective and time efficient.
Okay.
Yes, more
Yeah, that'll be
along those routes. Yeah,
yeah, okay.
very
And that'll
excited
be
about it.
better for people to be able to get it covered by insurance and things, I'm guessing,
Yes,
and lesser
yes,
costs and everything
exactly.
associated with it. Because for those who don't know, lymphedema is a lifelong condition that needs to be managed. So it's
Hmm.
many treatments that need to happen
Right,
for them to keep it at bay or manage the condition.
exactly.
Um, yeah. So I'm curious about this too, because I know in the course we teach that the most common reason for secondary lymphedema in the United States is from breast cancer surgery, particularly from the removal of lymph nodes and such, and so creating that risk for developing lymphedema in the
Hmm.
upper arm and the quadrants. Is that what you see a lot of in your practice, or is there all kinds of things happening?
Um, yes, so a majority of the patients I see in the clinic are stage 0 and stage 1 lymphedema.
Okay.
So, for example, when a patient has surgery and lymph nodes are removed, they're all instantly at risk for lymphedema. They are at a stage 0 lymphedema where out on the outside you're not seeing any symptoms, but
Mhm.
on the inside internally their lymphatic system is under more stress than it was, and it's working overtime.
Yeah.
So I see quite a bit of patients that are still in that stage 0
Hmm.
asymptomatic phase where I'm still performing a whole hour of manual lymph drainage to make sure everything continues to work well and stays calm. Um, and it's very beneficial to the patient. It only takes like, summertime, everybody's vacationing, people are getting on airplanes.
Hmm.
We're
Hmm.
in warmer weather,
Hmm.
and that really exacerbates lymphedema to go from a
Right.
stage 0 to stage 1. So, if a patient is already getting manual lymph drainage, it helps their system recover better from that to the
Mm,
point where they can reverse back from stage 1 to 0 a
yeah.
lot easier than somebody who wasn't receiving manual lymph drainage.
Yeah. Oh,
So
that's
I've
very
definitely come to
promising.
find that out. Yes.
Yeah. Oh, that's
Mhm.
awesome. I can only imagine that people with that risk for lymphedema get nervous every time they get step on a plane. And
Yeah. Yeah.
so that's got to be a challenge there
Hmm.
for sure.
Hmm.
I know enough of taking these classes and teaching them. I make sure I have my compression socks on when I fly,
Hmm.
and I don't have a
Absolutely.
damaged system or anything like that. So
Yeah.
it's the more you learn about this amazing system that I don't think enough people know about, and I'm glad
Hmm.
that there's more talk of it, and I hope more people choose quality education to do the work and
Yes.
yeah, not
Me
just
too.
watching Instagram videos and things like that.
Me
There's
too.
always someone, I don't know if you've experienced this in your classes teaching, there's always someone, "Have you seen this person on YouTube or with
Yeah,
Instagram?"
I
And I'm like,
do.
"Yeah,
Lots of
we're not gonna
stories.
talk about that right now."
Yeah, we
Um,
don't have enough time to talk about all of those
yeah,
stories. Yes, I agree,
exactly,
Michelle.
exactly. Exactly. So weeding out the good and the not so great is
Yeah.
really important for sure. And there's a lot, I got to plug ACOLS, of course, and a lot of work went into this oncology class, and I think it's amazing. And I want to actually sit through the whole thing and actually take it myself because I know I put a lot into on the background
Yeah.
end of it, but um in general, making sure people are getting the education and learning all they can about it and um we talked about being scared to get into the field, but also make sure you know that you don't know enough so that you have to go and learn
Yes.
and be able to treat your patients and clients as safely as possible. So that's really important. Yeah.
Yeah, absolutely. And I still have students, previous students, that are texting me, emailing me, hey, what do you think about
Hmm.
this? What do you think about this scenario?
Yeah.
And I absolutely love that when we're
Yeah.
able to get together like that.
Yeah, I know I get every once in a while, like, can I do this on this person? And I have to
Uh-huh.
remind, I said, what were the contraindications? Is that on
Hmm.
the list? No, you can do it.
Yes,
Like, yeah, make sure you
exactly.
think about it. But I like out there, like, there's still, I just want to make
Uh-huh.
sure. So that's fun.
Uh-huh.
Yeah. So Rachel, is there anything else that you'd like to share about the class or working with oncology patients or anything before we get into our little fun questions at the end for you?
um, well, again, it is an extremely rewarding area of work to get into. Um, I feel that most of these patients aren't aware of the resources that are available to them
Mhm.
in regards to managing their symptoms during cancer, after cancer, that involves services that you could be able to provide for them. They're just not aware that this is even possible or that this is even available. And so I love being able to teach this class to just kind of put the awareness out there. And I'm just hoping that whoever is able to come to the class can also kind of embrace that mentality as well and help spread the word out there, because really these patients, these individuals, they're going through a lot. And
Mhm.
if it takes something as little as being able to provide a service, manual lymph drainage, I mean, it really means a lot to them. And
Mhm.
so I'm just grateful for this opportunity to be able to teach it.
Yeah. Well, I'm
Hmm.
grateful you're able to come on and chat about this. I'm going to put up the website here if anyone is interested in finding out more about this course and other courses. Remember, you need to be either MLD certified or CDT certified to take the oncology course. So lots of options for those first two classes and the oncology course. We're picking up more options for that. I'm really excited to see it on the schedule more. But I think there's the webinars monthly, and then we have the courses or so. Like I think it's monthly, somewhere around that. I know it's going to get to that point if it isn't
That sounds
already.
about
Like I'm
right.
sure we're getting towards that, and we have lots of options coming probably in 2024 where they're going to be offered, and hopefully maybe you see Rachel in one of your classes if you decide to take
Yeah,
that. So
be so
um,
exciting. Yes.
yeah. So let's find out a little bit more about Rachel here. So I always ask these 5 questions at the end of our interview. And so I'm curious, which talent or superpower would you most like to have?
Um, I would I would probably say the power of telepathy. just because I'm terrible at reading people's minds. It's
Uh-huh.
not my forte at all.
Uh-huh.
And I guess I tend to be more of a positive person. And so, which is, I mean, it's good. It
Yeah.
works for me, it works against me, but I always
Yeah.
feel that people's intentions are really at their best. And
Mhm.
but I just feel that if I was able to read people's minds and intentions a little
Mhm.
bit better, then I think
Yeah.
it would help me in all areas of my life, personally
Yeah.
and professionally.
Yeah.
And so yeah, that's the power that I would choose.
Yes. Well, keep thinking positively about people, though. I know
Yeah.
sometimes I'm like, but no, we need more people like you. So don't. Yeah, I
And
believe in people too.
plus Dr. Gray on X-Men, she's was one of my favorite superheroes growing up.
Oh, nice.
So
That's awesome.
yeah.
All right, if you weren't in your current profession, which occupation would you most like to have?
Um I okay, so definitely one of those food and travel writers.
Ooh, that's a
Because
good
I
one.
love to do all three of those things. I love to
Yeah.
eat, I love to travel, and I love to write. So there you go. That's
Oh, that's wonderful. That
pretty
even
easy
sounds
one.
something that can be maybe your a retirement plan. You could do some
Oh,
little Rachel Wright.
fun. Yeah.
I love
I
it.
like that. I'm
Yeah,
taking notes, Michelle.
yeah. I'll be looking for it. Um, so if money and circumstances were not issues, where would you most like to live in the world?
um, I am very much an outdoorsy person, so
Mhm.
I love to hike and camp, mountain biking, and
Mhm.
so I always hear super great things about Canada. So
Mm.
maybe somewhere like Montreal or Vancouver, where you still have, the conveniences of the city life, but yet
Mhm.
the, nature is in your backyard.
Okay.
And I've been to Canada a couple times, and the
Mhm.
culture there is just very welcoming and
Mhm.
clean, and you just feel like a sense of safety every time that you're there.
Uh-huh.
And I have a couple of family members that live there as well, and they're just completely happy with just the overall lifestyle of it there. So maybe
Oh,
somewhere up in that
good.
region.
Okay. You can, yeah, Rachel writes Canada. I like it.
There you go.
Perfect. It's a huge country. You got a whole place to go.
There
So
you go. Yeah.
yeah. Mhm. What is your most treasured possession?
Um, my most treasured possession um, would be my Bible. I use
Mhm.
also my Bible as my journal. And
Okay.
so there's just different excerpts in there that I've had over the past 10 years with dates that I can reflect back on, and just really records successes and failures, particularly, and how I was able to work through that. And I mean, I lay hands on it every day just to
Mhm.
continue to learn and grow and keep me on the right track.
Is it a special one that you can like actually write in things and like reflect or?
Um, Not really.
Oh, okay. I
I
love
just
that.
write
That's
on the
better.
margins. It's
Okay.
organized mess. It's
Yeah.
organized chaos.
Yeah. Oh, I
Yes.
love that, but that's yours, and it's like it's totally you. I love
Yes.
that. That's a
Yeah.
great idea. And I'm almost like if someone didn't think of this before, it's probably a nice plan to have some kind of like writing reflection on the pages. But
Yeah.
I'm
Yeah.
sure there's
That would
something out
probably
there.
be better. That would probably be more helpful.
Yeah, but no, this makes more sense. To me, I'm with you. I get it. And then last but not least, what would you tell your 18-year-old self?
um, my 18-year-old self, I just moved out, living independently, freshman in college. Made a lot of dumb mistakes and choices. So I probably tell myself to remember that you have a purpose and not to shift too far away from that. I feel like over the past 25 years, um, I, the times that I've gotten sidetracked from my path is because I lost sight of what my purpose was. And so I felt like
Mhm.
maybe I could have achieved a little bit more. Maybe I could have helped more people along the way if I just always remembered what my purpose was.
Mhm.
Um, And also, I would tell my 18-year-old self that you actually do not hate cats. That you love them, and that you're going to have 3 of them,
Uh-huh.
and you're going to have one that just loves you, that wears a gold chain and wants to be carried around in your backpack everywhere you go.
Oh yeah, we should have like led with that, and I should have asked you to get a picture. So
Oh yeah, I'll forward you a picture. Yeah,
all
he's
right,
a
yeah.
trip. He's something else. But yeah, if I were to tell my 18-year-old self that, she'd probably just punch me in the face or something. She would not believe it.
Like you're getting soft in your old age is probably what I
Yeah,
told you.
exactly.
Yeah.
Exactly.
Oh, I love that. That's amazing. Okay. I have so many pictures now of seeing you and your cat now traveling Vancouver
That's
and
right.
getting
Yeah.
snacks together. I'm telling you, somebody should pick this up as like a TV show. I think it would be really good. Oh my goodness. Thank you for making me laugh this morning. And thank you
Good.
for taking the
Yay.
time today. I learned a lot and hopefully other people too to be inspired to work with this oncology population
Yes.
and know that there's lots of resources to be able to do so. So I appreciate you taking the time out today to speak with us.
Thank
And
you.
I hope I'll see you again, hopefully in person. Maybe I'll be in one of
Yeah,
your classes. So
that would
it'd be
be
really great.
wonderful. I would really love that, Michelle.
Yeah, me too. So everyone out there, thank you so much for watching, and we'll see you